really good question, because this is the major benefit that I find I can give people. Obviously, I can't advise people on treatment or diagnosis or something directly because I'm not a medical professional, but I can give them information. And when you talk to, it's over 3,000 people, I guess, I haven't kept track exactly, but about that number or more on the phone about their cancers, the patterns just jump out at you. It's not difficult. I mean, this is not something that requires analysis. And what it is boiled down to for me is that there are three primary causes of all cancers, with very few exceptions. I mean, obviously the exceptions are people who work in a very toxic environment all day, in a factory or as a hairdresser or something, where they're breathing toxins. These are exceptions, and they're important to identify, but 99% of the people I talk to can agree with me that one or more of these three things are what brought on their cancer. The first one is some kind of an emotional event or a period of stress, emotional stress that went on for weeks or months sometimes, or it could be an event like the loss of a child or a difficult divorce, taking care of an elderly relative with Alzheimer's, things that stress people beyond their normal stress, daily stress. This produces cortisol, which you may be familiar with. It's a hormone produced by our endocrine system to cope with stress. It's a very acid substance, and when you get cortisol in your body, you make it more friendly to cancer cells because they like an acid environment. And of course, it challenges your immune system to where it's weaker than it should be, and the cancer will get out of control where it may not have otherwise. So the emotional is frequently, about 60% of the time of the people I talk to, it's a cause that they can readily identify. Something that happened in the period of 18 months, give or take 6 months, prior to the diagnosis of the cancer, generally. But the second thing of the three is the most common, and that is what I call dental toxins. Dental toxins, what people have in their mouth, in their jaw, is such a frequent cause of cancer that it's just almost 100%. I'd say it's like 95% of the people I work with have clearly dental toxin problems that were directly related to their cancer. And, I probably sound more convinced of that than you would think, but the reason is simply that these people that I work with have tried everything under the sun, conventional. Most of them go the conventional route to begin with. They go to the doctor, fix me, I've got cancer. So they go through the chemotherapy, the surgery, whatever. Nothing works. They finally recognize that there's no answer there, and they begin their own process. They read something like my book. In most cases, they've read my book and have tried my recommended regimen of simple dietary supplement changes and so on to their lifestyle. And they may make a little progress, but they get to a plateau where they don't seem to be getting any better. And suddenly they recognize by some means, many of them by talking to me, that the problem is in their jaw. They go get it cleaned up with a good biological dentist of some kind. Not many of them around. They're very rare, by the way. But they go to one of these people, get their mouth cleaned up, and they get well. 4 or 6 weeks later, they're free of cancer completely, and they're over it. This is, dramatically affects people's health to the extent that I just tell people the first thing you need to do, the priority one, is to go to a good biological dentist and get your jaw evaluated, because it is almost always involved in your degenerative condition, whatever it is, cancer, fibromyalgia, chronic fatigue syndrome, ALS, MS, heart disease. All of these things that are degenerative chronic conditions have been related to dental toxins to a greater or lesser degree, and certainly cancer is very, very susceptible to dental toxins. So I always say people you must explore this one completely, and then, once you've got it taken care of, you can go on to other avenues. And the third thing is simply what we put in our mouth. Obviously, for most people nowadays, it's not heavy smoking or drinking. That used to be more of a problem than it is now, probably, but everybody eats food, and none of us eat a perfect diet, and eventually it catches up with us. The cumulative effects of diet include, of course, cancer. And there really is no way to recover from cancer without radically changing and permanently changing your diet, because it's such a contributing factor. Obviously, there are lots of opinions about what's the perfect diet and how to structure it and so on. I try to encourage people to make it simple, to keep it simple. Eliminate 5 types of things from your diet, and you're going to get well in almost every case. Those things are sugar in all forms. Obviously, sugar is very, very harmful, not just for diabetes, but certainly for cancer. Processed food, literally everything in the center portion of the supermarket is almost all unhealthy, let's face it. But if it is not in the form God made it and you're trying to recover from cancer, you don't eat it, basically. You eat things that are raw in the way God presents them to us, essentially. Dairy products are very harmful to cancer. All kinds of dairy, including raw milk, goat's milk, it's all harmful. Animal protein is one of the main things that make us sick. We eat cooked protein, which is very hard to digest and eventually causes our cells to clog up with undigested protein. And finally, gluten, bread, cereal, pasta. All of these turn into sugar, to glucose very quickly. So if you equate gluten to glucose, you're going to be pretty close to correct. It's not that far apart.